So I'm going to make it a combined goodwill message on behalf of the Minister of Health, Dr. Henry, and of course, my own as well. I am elated to be invited to be part of this program of the grant award flagged off by the Central Bank of Nigeria on healthcare research and development intervention scheme on the production of new and improved drugs, vaccines, and diagnostic of infectious diseases in Nigeria. Research and development for new health technologies is an integral part of the solution to the world's greatest global health challenges and one of the biggest drivers of health improvements worldwide. It is a landmark development in our nation to see the Central Bank of Nigeria intervene when needed most and provide the needed catalyst to promote research and development in healthcare. While tremendous progress has been achieved in global health over the last several decades, millions of people still die each year from infectious diseases and other health challenges in the sub-Saharan Africa. We will not continue to make progress against existing and emerging global health threats using current technologies alone. New vaccines, drugs, diagnostics, and other health tools are needed to continue the arc of progress. Health, research, and development has a multiplier effect. It not only saves and improves lives, but also creates cost savings, drives economic growth, and enhances global security. The COVID-19 pandemic has affected businesses globally, destroyed economies of even the strongest nations, and more resilient healthcare systems are also gasping for survival. This grant is very timely. Gradually, the pandemic is shaping the political and social beliefs of many nations, and we can only be grateful that in our case, we're improving on the existing structures at the Federal Ministry of Health, Nigeria Center for Disease Control, National Primary Care Development Agency, and other health research institutions to mitigate the impact of this common foe of mankind. Global health authorities like the World Health Organization have attested to the response of Nigeria to the pandemic. The question is, are we where we want to be in healthcare? Of course, the answer is no. Hence, this remarkable event we are witnessing today. The role of funding in response to COVID-19 pandemic cannot be overemphasized. Hence, the need for intersectoral collaboration in achieving universal health coverage and attaining the SDG targets 2030. The COVID-19 pandemic has shifted attention away from other very important healthcare needs like routine immunization, malaria, HIV/AIDS, antenatal and family planning. It is therefore very critical that as a nation to collectively sustain the momentum towards overcoming this pandemic and other diseases, then life can return to normal and our society can blossom again. It is on this note that our dear President, Muhammadu Buhari, established the Presidential Task Force on COVID-19, and ably headed by Boss Mustafa, the man that we in the PTF have conferred on MPH, Master of Public Health, which brings several ministries and agencies together in a whole-of-government approach to mitigate the impact of the pandemic in Nigeria. What we are witnessing today is a testimony to the creative policy of the current administration and the support the government has given to Central Bank of Nigeria to carry out its statutory responsibility. The leadership of CBN, as part of its policy response to the COVID COVID-19 pandemic has introduced the Healthcare Sector Research and Development Intervention Scheme to help strengthen the public healthcare system with innovative financing of research and development in new and improved drugs, vaccines, and diagnostics of infectious diseases in Nigeria. Specifically, Healthcare Research and Development Intervention Scheme is designed to trigger intense national research and development activities to develop a Nigerian vaccine, drugs, and herbal medicine against the spread of COVID-19 and any other communicable or non-communicable diseases through the provision of grants to biotechnological and pharmaceutical companies, institutions, researchers, and research institutes for the research and development of drugs, herbal medicines, and vaccines for the control, prevention, and treatment of infectious diseases. The scheme is intended to boost domestic manufacturing of critical drugs and vaccines to ensure their sustainable domestic supply and reduce the bulk manufacturing costs of the drugs, herbal medicines, and vaccines in Nigeria. Since the index case arrived in Nigeria on 27 February 2020, several proposals have been sent to the ministry on various drugs with claimed efficacy for cure of COVID-19. We have sent samples to the relevant agencies like NIPRID, the National Institute of Pharmaceutical Research and Development, and NAFDAC for validation and possible adoption. So far, none has been confirmed as cure for the disease. Rather, they offered remedies to some known symptoms of COVID-19. It is my hope that our researchers will take advantage of this grant to provide Nigeria with indigenous drugs that can control this infection and possibly other infectious diseases and non-communicable diseases alike. Permit me to reiterate again in this gathering that we have 2 locally developed potential candidate vaccines listed on the WHO website. The Helix Biogen Consult, Ogbomoso and Trinity Immuno Efficient Laboratory, Oyo State, and the one being developed by Professor Happy and his team at the Redeemers University, Ede. And we have approved all support necessary to make the development of indigenous COVID-19 vaccine a reality. As we all know, funding is critical for realizing development and manufacturing of any vaccine. It is my hope that these researchers meet your criteria for eligibility and that they are here today as part of the recipient of the grant. Boosting the morale of our own researchers will create a value chain that has ripple effect in terms of more jobs for our citizens, significant decreased overdependence on advanced nations for vaccines and other important drugs, and we can start to reduce the huge capital flight involved in procuring vaccines and other drugs from foreign countries. To their colleagues and researchers, I am particularly glad that the much needed support is being provided, and it can stimulate your capacity to develop indigenous vaccines and other critical healthcare needs to mitigate capital flight occurable as a result of importation. We have critically looked at the objectives of the scheme, eligibility criteria for accepting the research proposals, and board of experts that made up the teams to scrutinize the proposals, and I have no doubt in my heart that they have done a great job. May I say that the Federal Ministry of Health has positioned the Research and Knowledge Management Division of the Department of Health Planning, Research and Statistics to have a complete oversight, provide repository of relevant COVID-19 and other related research, and periodically advise policymakers. In this light, let me request the Central Bank of Nigeria to use this opportunity to strengthen the Department of Health Planning, Research and Statistics of the Federal Ministry of Health to be able to keep track of this laudable initiative and also keep our various researches within the ambits of policymakers and future reference. Finally, let me welcome all participants and congratulate all the beneficiaries and deeply appreciate the efforts of the CBN Governor in providing very critical intervention at this point in time. It will be a delight to you to know that CBN Governor, you are not just promoting primary healthcare system. The impact of the intervention, when well implemented, will strengthen our healthcare system in general. The global impact of COVID-19 pandemic on the economy and health of the nation is evident to all of us. And this symbolic intervention is a step in the right direction to our dear nation. While congratulating the CBN Governor and his team for this laudable intervention, I thank you for your kind attention.